Hello, today I will be performing a full head to toe assessment on Mr. Jones, who is a 57-year-old male, who's a father of two and is also diagnosed with diabetes. He's coming in for his annual checkup, and he's also with complaints of fatigue, weakness, and loss of sensation to his fingers. Mr. Jones is alert and oriented times 3 to place, person, and time. He is also dressed appropriately and is age appropriate.
Come in.
Hi, my name is Stephanie, and I'm going to be your nurse today. How are you doing?
I'm doing okay.
Okay, that's great. Could you please give me your first name, last name, and date of birth?
Marcia Jones, June 10th, 1964.
Great. So what brings you in today?
I'm here for my annual physical.
Okay.
And
Is there anything else?
oh yes, I've been feeling fatigue, weakness, and tired. And the other day.
So how long has this been going on?
About a week.
About a week. Okay.
Yeah. And the other day, I was doing the laundry, I lost the sensation in my fingers, my hands.
Okay. All right. So I'm gonna note this in your chart, and I'll let the doctor know. So when he comes in to talk to you, but for now I am going to conduct your annual physical, and I'm gonna do a complete head to toe assessment. Is that okay with you?
Yes.
Great. I'm just gonna go wash my hands before we begin. Okay, Mr. Jones, to begin with the assessment, I will start with taking your vital signs. Is that okay with you?
Yes.
So I'll start with checking your heart rate. Patient's heart rate is 90 beats per minute. Also, I'll be taking your blood pressure. Okay, good, thank you. Blood pressure went over 90. Respiration 18 beats per minute. And temperature is 97.9. Now we will be moving to, so now that we're done with your vital signs, I will start with assessing your head, eyes, ears, nose, and throat. Is that okay?
Yes. Patient's
head is round and hair is evenly distributed. Patient's conjunctiva is pink with scarlet white. His eyes are bilaterally symmetrical, and I'm going to shine this light in your eyes. Perla noted pupils are equally round, reactant to light and accommodation, and extraocular movements are intact. Mucosa is pink and moist. Septum is midline, and septum is midline. Can you please open your mouth and say ah?
Ah.
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 Buccal mucosa is pink and moist. Tonsils and uvula is midline. Teeth are white, evenly distributed. Gums are pink, and gums are pink. No lesions or mass noted. Patient's ears are equal and bilaterally symmetrical. No piercings are noted. Tympanic membrane is pearly gray and intact. Could you please hold on, press down on one of your nostrils and breathe in, and do the same with the other one. Breathe in. Okay. Could you please close your eyes, and I will place something under, and you just let me know what smell.
Coffee beans.
Patient's nares are patent and sense of smell are intact. Patient's neck is supple and smooth. His trachea is midline and straight. No lesions or masses are noted. No JVD noted. Palpated for nodes, no nodes noted, and thyroid is not enlarged. Mr. Jones, can you please shrug your shoulders for me? Shoulder shrug test shows strength 5 out of 5. I'm going to now have you had any difficulty breathing, shortness of breath, chest pains recently?
No.
I'm going to now take a listen to your lung sounds. Is that okay?
Yes.
Can you please breathe in, out, in, out, in, out, in, out, in, out, in, out. Thank you. I'm going to listen to your breaths from the back. Breathe in, out, in, out, in, out, in, out, in, out. Okay, thank you. Normal breath sounds were noted. No wheezings, crackles, or wails heard upon auscultating the lungs. And now we're also going to listen to your heart. No murmurs, heaves or thrills heard. And have you had any issues with your bowels or your bladder? Like any diarrhea?
No, ma'am.
No. Okay, so I'm gonna listen to your bowel sounds as well. High-pitched gurgling sounds were heard on all four quadrants of the abdomen. I will palpate. Do you feel any pain?
No.
No tenderness was felt. No pain or tenderness felt in all four quadrants. Palpated pulses. Palpated the radial, femoral, posterior, tibial, and dorsalis medius pulse. Pulses are regular rhythm and strength 2+. The extremities are warm and moist to touch. Do you feel any pain
No.
when I press your calf?
No.
No calf pain, tenderness. The skin color. Patient skin color is appropriate to ethnicity. It is moist and warm. Skin is intact. No lesions. No swelling noted. Skin snaps back when turgor test is performed. Cap refill, less than two seconds. Noted Acheron nigricans are in the back of patient's neck. So Jones, we're about to do your neurological assessment. Patient's posture is straight. No involuntary movement. Could you please stand up? Patient posture is still straight. No involuntary movement. Mr. Jones, I will have you please walk to one end of the room and back. Thank you. Patient's gait is smooth and straight. I'm gonna also ask you if you can please place your feet together. Close your eyes and lift up your arms in front of you. Close your eyes. Thank you. You may open your eyes. Patient shows negative rhombus test. No swaying was noted. Could you please, I'm going to ask that you stretch your arms and try to place your index finger on your nose, and then you will do it again with your left hand. Close your eyes. Okay. Okay. Other hand. Okay. Thank you. So it shows no balance issues. Can you you may sit down. I am going to have you close your eyes, and I will draw a number on your hand, and if you can please identify what number I have drawn in your hand. Close your eyes. Can you tell me what number I just drew in your hands?
7.
Okay, keep your eyes closed. I am placing an object in your hand, and if you can tell me what object is in your hand. Okay, thank you. Okay, Mr. Jones, everything looks good. Okay, Mr. Jones, so that completes our head-to-toe assessment for your annual physical. Do you have any questions for me?
No.
So before you leave, I just wanted to give you a little bit of reminders of some hand and foot care that you should try to follow as a diabetic. You said that you felt some loss of sensations to your fingers, and so this is normal for diabetics to start feeling some loss of sensation. So with that is why we we recommend that you do not walk barefooted when you're in the house, because you could step on something or you can stub your toe and hurt yourself, and you will not really feel it, and then that will lead to an open wound that doesn't heal properly. As a diabetic, you usually heal a little bit slower, so that would cause to having infection. I would also say that you should avoid soaking your feet. You should not soak your feet in water. And if you need to get your toes done or your nails cut, you should go to a podiatrist to have that done and not do it on your own. But if you do need to cut your nails, you should be cutting your nails at a rounded angle, and you should follow your nail bed. Do you understand what I just told you?
Yes.
Can you repeat back to me?
Yeah, you told me that I should wear sandals to make sure I don't step on nail and get cut. If I need to cut my nails, it's better if I go to a podiatrist, and if I absolutely have to cut my nail, cut it in a round circle to avoid lesions.
You have to avoid you cutting yourself and then potentially catching an infection. And also, do not soak your feet.
Okay.
Okay. So that concludes my part. I will just hold on and we'll wait for the doctor will come in to see you.
Okay.